Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
A psychiatric mental health nurse practitioner student is reviewing his notes from his clinical experience over the past week to prepare his first required case presentation on a patient suffering a major depressive episode. Which of the following patients best represents the DSM V TR criteria for major depressive episode? A 27-year-old female with a 1-month history of social withdrawal, anorexia, hypersomnia, unprovoked outbursts of anger, and a strong family history of endogenous depression. B, a 41-year-old male with a history of childhood sexual abuse, loss of interest in both his professional and personal life, an unplanned 10-pound weight loss in the last 3 months, and perceptual disturbances. C, a 65-year-old male whose wife died 6 months ago, who reports a 3-week history of generally depressed mood, extreme guilt about his wife's death, insomnia, difficulty focusing on daily tasks with increasing thoughts of dying. Or D, a 72-year-old female who just relocated across the country to live with her adult son and daughter-in-law, who is despondent about leaving her home and reports forgetfulness, loss of appetite, new onset bowel problems, and extreme loss of energy. So this is a diagnostic question. Really, this is a question that is asking you to evaluate 4 different clinical circumstances and identify that clinical circumstance that meets diagnostic criteria for a major depressive episode. Remember, one of the biggest reasons that people don't respond to treatment for depression is that they don't actually have a major depressive episode or major depressive disorder. And so making a diagnosis of major depressive episode really requires a careful attention to the absence or presence of the diagnostic criteria that's identified by the DSM-5 TR. Of course, once the patient is identified with those criteria, then it's important to rule out all other causes of those symptoms, to rule out substance abuse or a medical condition. But once you have ruled out those other causes, a minimum of 5 symptoms from the 9 domains over a 2-week period at a minimum is your diagnostic criteria. And only one of these patients actually meets those diagnostic criteria, and that would be patient C, the 65-year-old male whose wife died 6 months ago, who reports a 3-week history of generally depressed mood, extreme guilt about his wife's death, insomnia, difficulty focusing on daily tasks, and increasing thoughts of dying. DSM-5 TR criteria for a major depressive disorder or major depressive episode includes 5 of 9 primary symptoms, most of the time over the preceding 2-week period, one of which must be depressed mood or loss of interest or pleasure. While each of these patients manifests some of the symptoms, the only one who meets these criteria, at least 5, including depressed mood. And remember, those 5 symptoms, or those 9 symptoms, are depressed mood, loss of interest or pleasure, significant unplanned weight loss or gain, sleep alterations, psychomotor agitation or retardation, fatigue or loss of energy, feelings of worthlessness or guilt, inability to concentrate, recurrent thoughts of suicide. Those are the 9 domains, and the only option that meets at least 5 of them is C. Additionally, loss of a spouse is one of the single most prevalent environmental risk factors for a major depressive episode. And so when you look at his history of the death of his wife 6 months ago, this is far beyond a healthy grieving period. His wife died 6 months ago. He clearly reports at least 5 of those 9 symptoms from our DSM-5 TR diagnostic criteria, and that's why C is the best answer of those provided.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.